Hello, welcome to our first podcast of 2024. I hope you are having a great start to the year and hopefully making good progress in your staying well actions. I am Yoseph Araya, a senior lecturer in environmental sciences from Open University. Today, we are joined by our special guest Sonal Mehta, who works for the NHS, and our regulars, Dr. Jitka Vseteckova and Ellie Broad from MK Parks Trust. Today, while following our theme of aging well and natural spaces, we are addressing the topic of health inequality, what its impacts are, and how it can be addressed. We will start first with Dr. Jitka, who will give us a background to healthy living first. Over to you, Jitka.
Thank you, Yosef, and hello, everyone. So we are all aware from diverse messaging around us that our physical and mental health and well-being is an important thing for us to keep an eye on throughout our lifespan and as we grow older, because we just all are. In our previous podcasts, we have talked about the best ways to do that. And in the work I do specifically at the Open University, this evolves around the 5 pillars for aging well. These are nutrition, hydration, physical, social, and cognitive stimulation. And some of you might already be familiar with these from the Aging Well public talks that have been now running for 5 years. We have also co-produced between the OU and Ellie at the Parks Trust and Sonal at the BLM C.I.C many resources such as open learn public-facing articles and podcasts that support us looking after our health, and these are available on the Open Learn platform and also on the Parks Trust website and our joint YouTube channel where we have placed all our co-produced podcasts to date. These looked at, for example, boosting our memory and generally supporting our health and well-being while staying outdoors and also as we age. We often talk about aging well from the perspective that we all age from the moment we're born, and sometimes this is reinforced by talking about staying well and keeping well, not just aging well, but these in the work we all do are the same thing. The current research suggests that the sooner we start taking good care of our physical as well as mental health and well-being, the more likely it is for us to stay well, keep well, age well. And as I said, in the work we do, these are synonymous. In the previous work, we have explored nutrition, hydration, physical and social and cognitive stimulation. And today we would like to add to these a perspective on health inequalities. Health inequalities are unfair and avoidable differences in health across the population and between different groups within society. And these include how long people are likely to live, the health conditions they may experience, and the care that is available to them. We may or may not be aware that these structural health inequalities could be one of the barriers we might be experiencing in looking after our health, access to care and services, and as we realize from our joint work with Yoseph, Sonal and Ellie, also to learning. So today we're here to talk about learning in nature, accessing nature, and discussing how to work with or around some of these structural health inequalities that might challenge us to do so. So back to you, Yosef, and please tell us more about this, how these are linked to learning.
Yes, thank you, Jitka. The benefits of interacting with nature is well known. From the physical benefits, that is, for example, exercising our bodies, to the mental health benefits, for example, providing us time to reflect and relax, and of course, the social element that is engaging with others. While it is well known, well, these benefits are, learning about them also helps to improve engagement with nature, thereby positively affecting well-being. Recent studies actually have shown that it will help mental health and well-being if one is also learning about their interactions. This has also been picked up by, for example, the UK government and the National Health Service, where they are trying to integrate awareness and care for nature. For example, is it in the school curriculum or whether it is embedding in nature learning throughout the curriculum. Now, in our increasingly sedentary working and lifestyle, there is a lot of lack of exercise, and there is often reduced need for exercising, which means various other health issues are becoming even more and more frequent. I mean, lack of exercise has been linked with uh, weight issues, type 2 diabetes, and even some types of cancer. And of course, the social isolation element and also mental health has been really apparent as well. So, the benefits to people when engaging in natural spaces is recognized, and which means that with recent evidence, even urban design areas or green spaces are being incorporated in uh, engagement and in treatment as well. In fact, the National Health Service actually recommends being active, but also being active outdoors. But unfortunately, there is inequality in access to green spaces to the general population and within our society. And despite the known benefits, and especially to those who need them most, there does appear to be a lot of inequality. And it is not only here, but it has been recognized in several studies in other countries as well. Sonal will hopefully address some of this in her points now. Over to you, Sonal.
Thanks very much, Yosef. So, Yosef has described the sort of the range of benefits that we can derive from engaging with nature, whether that's from a health and well-being point of view or a learning point of view. But he's also described, alluded to the fact that these benefits aren't seen equally across different sections of society. So there's existing inequalities in a number of areas, which means that some individuals and communities are less likely to access nature, or if they are able to access it, they may have a less positive experience once they're there. The restrictions we had during the COVID-19 pandemic meant that a lot of us became much more aware of the nature that's on our doorstep, and the benefits that we can gain from engaging with nature. Unfortunately, we also saw, we also became much more aware of the inequalities that exist in society, and in some cases, we saw them widen. So, for example, those that didn't have access to private green space like a garden didn't experience, didn't have the same level of benefit that other people might. So while people from all different backgrounds value nature, there's nearly 3 million people who live in the UK that are more than 10 minutes walk away from a green space. Now, that may not sound like a lot, 10-minute walk, but actually it can make a big difference in terms of the effort required. So, just to give my own personal example, I've got a garden. I'm very fortunate to have one, but I come across so much nature just walking to the local shop. There's absolutely no effort required on my part to be able to put a smile on my face watching a little duckling swim across the pond, for example. So it's that effort that's involved for some people, and their broader circumstances then create other barriers. So it's no surprise that people living in urban areas, for example, will place more value on access to green space, and even there we see an unequal distribution within urban areas. So people that live in more affluent urban areas will also will tend to have more parks and green space available to them.
Sonal, that's very exciting that you are mentioning there are a lot of key points like this. Could you elaborate some which might be relevant to some groups of people as well?
Yes, sure, Yosef. So, if we think about people's financial circumstances to begin with, that can really compound a lot of these issues further. So, if there's sort of charges or expenses associated with accessing parks and green spaces, that can create barriers. So, entrance fees, or the cost of parking, or even the cost of public transport. And then for some groups, actually, it's a lack of suitable public transport may mean that they have trouble getting to a green space. So, sort of taking this in the round from a financial point of view, though, sort of communities that live in deprived urban areas actually experience a double whammy whammy in terms of their health inequalities. So that, you know, they're already more likely to experience poorer health outcomes just because they live in a more deprived area. But then they also struggle to access one of the things that are likely to prevent them from sort of feeling or getting worse in terms of their health. And then you've got other groups struggle to access nature for different reasons, or, you know, they may access it, but they have a poor experience once they get there. So people with disabilities, for example, they may experience combined financial and transport barriers more than the general population. And then once they're there, it's suitable provision. So even paths for those that use wheelchairs, accessible toilets, or plenty of seating for people that have mobility issues. If these things aren't in place, it can create further barriers and lead to poor experience, and then reduces the benefits that an individual might gain from going to a park or a green space. Others that also may have a poor experience are people from ethnic minority backgrounds, people from LGBTQ plus communities, and women and girls. So if we think about people from ethnic minority backgrounds to begin with, quite often there might have been less emphasis on engaging with nature, especially when they're younger. So they don't necessarily know where to go, what to wear. You may need to, certain activities may require a bit of preparation or specialist equipment. And if you've got this, an absence of childhood experience, it can lead to less confidence as an adult, and actually that can become self-perpetuating through future generations. People from ethnic minority backgrounds may also have experienced racism, and that can lead to feelings, feeling unsafe or unwelcome in certain spaces, but that tend to maybe be accessed more by people from a white background. Someone from an ethnic minority community might just feel that space isn't for them. And those feelings of of lack of safety or not being welcome can also be experienced from from people from other communities, as we said, LGBTQ plus communities. People from people from those communities may also have experienced discrimination in public spaces. And then we also need to pay special attention to women and girls as well, because quite often they also don't feel safe or welcome in some of these spaces. Quite often, a lot of the activities or the provision, it can often be perceived as sort of more geared towards traditionally male activities like sports, for example. And if there's poor maintenance of lighting, that in sort of winter evenings, that can lead to feeling unsafe as well. So as you can see, many of these issues, they're not single issues experienced by an individual. Actually, they're interlinked issues and can really compound each other. So I think it's really important we see access and experience of nature as a social justice issue, and leading on from that, that the more you feel connected to nature, the more you want to protect it. So actually it also links to being a climate and environmental justice issue. But it's not all doom and gloom. There's loads of fantastic local interventions, and I'll hand over to Ellie from the Parks Trust now, who can talk to you a little bit more about what's happening in that space.
Yeah, thank you, Sonal. It's a really good introduction. So my name's Ellie, and I work for the Parks Trust in Milton Keynes. And we're a self-financing charity, and we care for 6,000 acres of parks and green space in Milton Keynes, which is about 25% of the new city area. So I'm here today to talk a little bit about what we're doing as park managers, and what's happening in the parks industry to tackle these health inequalities in an outdoor setting. Because obviously we're all really passionate about the outdoors, but we know we've got a responsibility to help other people to gain the benefits of green space as well. So public parks are just an amazing resource for health and well-being, and in a lot of cases they're kind of completely free to visit, and they're open a lot of the time. So they're kind of situated on people's doorsteps. So they're maybe the primary place people would kind of interact and interface with green space in their local area. Sometimes access to destination parks is limited by access to a car, as Sonal said. Particularly sometimes remote landscapes, they can be miles from towns and cities. So if you think about the UK's national parks, they're actually really far away from a lot of civilization, which is part of the reason why they're so beautiful and appealing to some groups of people, but is another reason why for others they're quite inaccessible and hard to get to. But in the UK, we are really lucky to have many green spaces on our doorstep. So lots of towns actually have local nature reserves, community gardens, or even recreation fields. And you might be surprised that there's one on right by your house where you live, and you've never thought to explore it before. I think a lot of people discovered green spaces during COVID, as we said at the start, but that's sort of tailing off now. So perhaps people could be inspired to go out and find something new. We're particularly lucky here in Milton Keynes because the parks in the new city were designed alongside the urban areas. So the landscape architects were thinking really closely about how they wanted to design the city so that people could have access to green space right from their doorstep. And that means that we benefit from this amazing network of linear parks that weave all the way through the city. Plus, we also have access to the Grand Union Canal, which runs all the way through the city too. And that provides a really good green corridor for people and wildlife. And Sonal was saying that there's 3 million people in the UK who live more than a 10-minute walk from a green space. But actually in Milton Keynes, we've got pretty much everybody lives within a 20-minute walk of a local park. So yes, it's a little bit longer, but the way the city's been designed has been quite future-proof in that sense. So the parks are available to people wherever they live. And this applies to kind of affluent areas as well as more deprived areas. And lots of the homes in the city were built with gardens. So during the COVID pandemic, lots of the residents of Milton Keynes did benefit from having access to green space right outside their back doors. So here at the Parks Trust, we have a really great education programme, and this encourages children from really young ages. So we've got a education programme that goes actually from like 0 and 1 years old, so called Tree Tots, which encourages people to start learning about nature and natural processes from a really young age. And our goal is to foster lifelong enthusiasm in these groups to help people recognise the benefits of green space right from a young age. And lots of our workshops are either completely free or they cost a very nominal fee to attend. So they're open to everybody. So we've removed that barrier in kind of from a very young age. But we also engage with adults through volunteering programs, guided walks, workshop activities. And it's been really interesting over the past few years of my working at the Trust to kind of witness the way people use their local parks and see how this has changed over time. So as I said, as the city was designed, the idea was people would step outside their front door and visit their local park. But actually, because of COVID, it's slightly changed. Now people are venturing a bit further afield. They're crossing the city. They're perhaps taking a drive or cycling across the city to visit something different, to find their favourite parks. So when you are visiting a park that's further afield, my bit of advice would be just really check ahead to see if it is serviced by local public transport, because often the first thought is to just hop in the car, but sometimes the parks are actually really well serviced by public transport, and that's true kind of all around the UK. And also now lots of parks are being fitted with bike parking, so cycling, once you've got a bike, it's completely free. It's also low carbon, which is brilliant. So a car might not always be necessary for visiting a green space. Sonal mentioned about health inequalities for people who are living with disability. And we've recognised this at the Parks Trust because we have inherited a lot of landscapes which were designed at a time where disability wasn't really considered in the layout of different places. And we've now got a lot of landscapes which are quite physically inaccessible to a lot of people. So we've started out on a journey to improve accessibility in our parks. And a huge tranche of this work is about providing people with the information that they need before they go out and visit. So I don't know if you're like me, but I always like to look at the menu of a restaurant before I get there. So it's that sort of thing, giving people a flavour of what that place is like so they can plan accordingly. So for many people, just knowing how big the park is and where they can park the car or their public transport links, that can remove a lot of anxiety about getting outdoors and make people feel more welcome. So to help us do this work, we've enlisted the help of a panel of access ambassadors. And these are individuals who have lived experience of disability in many different forms, and they're helping us to guide our work. They're encouraging us to think creatively about getting people out and about all across the city. At the Trust, we also hold the Milton Keynes Health Walks, which is a weekly rolling programme of walks around the city. And the idea is to boost participants' physical, mental, and social well-being, which taps into what Jitka was saying earlier about the 5 pillars to aging well. And these are just really popular, and there are paces and routes to suit everybody. But most local authorities will have a similar programme if you search for it online. Likewise, Milton Keynes is a really diverse city, and we have communities from cultures all around the world here, which makes it so much richer as a place to live. And we love to celebrate different cultures in our parks here at the Trust, and we host many different events throughout the year, including kind of big flagship events such as India Day and African Diaspora Day, to name just a few. And we love helping community groups to lead their own events in our parks. So we've got a programme similar to the Access Ambassadors, which is we call Community Ambassadors, where we provide different cultural groups with advice on leading activities safely in the parks, and helps us to understand as well how we can make our wider events programme more inclusive. Sonal also mentioned kind of a current topic is about how parks are not feeling so safe for women and girls. And there has recently been a study completed by the organisation called Make Space for Girls, which researched the barriers to accessing green space amongst girls and women. And sadly, as Sonal said, women generally feel less safe in parks than men, and therefore don't visit as often, which means they're missing out on exercise, fresh air, mental health benefits, and a whole array of other benefits that you get from green space. Make Space for Girls are actually campaigning for park managers to implement new safety measures to make the parks more equitable. For example, campaigning for adding lighting, having a greater staff presence in the parks, and making sure that wayfinding is really clear so people know how to enter and exit the green space. And at the Trust, we have our own Women's Walking Network, which is a programme just for women, which offers a safe and friendly environment for people to explore and exercise together. So obviously I've given a flavour of Milton Keynes, but it's true across the whole of the parks sector in the UK. People are working really, really hard to promote equitable access to the great outdoors. So you might be surprised to discover the number of different ways that you can get involved. However, we recognise that as custodians of green space and blue space, we always can do more, and we always welcome public feedback on the ways that we can improve.
Thank you, Ellie, for providing us a fascinating insight into what can be done and what is being done locally in Milton Keynes. And thank you, Sonal, for providing us a view of what inequalities exist and that there are many of them. And in general, it shows that we have to address this as a partnership together. As we conclude our podcast, I'm just going to ask our panelists just one advice they can suggest about how to tackle inequality of space in green spaces. Let me start with Jitka. What would be one advice you would say for improving this?
Thank you, Yoseph. From my part, it would certainly be partnership and participatory approach, such as co-production, where we're involving people with lived experiences in the work we do, that is supposed to help them and support them and have practical impact. So, for example, like the work Ellie mentioned earlier about the 5 Ways Cafe. So that would be my my bit. Thank you.
Brilliant, Jitka. Sonal, what would you have one advice?
Yeah, so I think I would really encourage health professionals to build on the good work that's already happening between the NHS and other sectors, so that we can really start to improve on you know, the benefits that people can experience in terms of their health and well-being. You know, Jitka mentioned right at the beginning that actually more, you know, that 80% of our health and well-being actually is affected by things that sit outside of the health service. So I think the more that health professionals can start to make connections outside of their own sector, and work in partnership with others, it would be really helpful.
Excellent, thank you, Sonal. Ellie, what would you have on your
Yeah,
case?
I think I would say something similar to Jitka, really. So I think the way to do it is to provide much more face-to-face support and encouragement for people from different groups. to help them feel confident exploring green space. So we do a lot of this at the Trust, but I always feel like we could do a lot more, helping people from different backgrounds to really get to grips with what it means to go outdoors and all the benefits that they can find there.
Thank you, Ellie. And if I may say, on my case, is I would think that designing for addressing inequality from the very early start is probably one very good way of addressing issues before they arise. But overall, I think I'm really pleased to know that we have a lot of activities being done and understanding of what are the limitations in ensuring that our society benefits as much as possible and equally from our existing green and blue spaces. Thank you very much for listening. And I would like to conclude this podcast by thanking our panelists and you, our listeners. And next time, we'll be looking at social prescribing, especially focusing on green social prescribing to include medicine inequalities and facilitate learning about taking active and healthy approach and avoid taking medicines if healthy habits of hydration, going outdoors, and not being sedentary might prevent us from needing them. And we will do that about healthy activities across the lifespan.